Introducing the African Diaspora News Channel app, your gateway to stories that's overlooked by the corporate mainstream media.
And we serve as the voice to the Toubou Black community.
Again, we got Dr. Candace Matthews.
A lot of these documents, looking at.
This country is supposed to be about the land of the free for all. It has not been free for Black people, and we are tired.
With our platform, we're helping to end injustice by exposing it.
Join us in standing for excellence in journalism and serving our community. Download the African Diaspora News app today.
Hello and welcome to the African Diaspora News Channel. I'm Whitney Mckoy. So tonight we're going to be talking about a developing story outside of Kingston, Jamaica. One that really has gripped the nation and has raised urgent cries about healthcare conditions at one of the island's busiest public hospitals. Let's get into this. Since June 1st, 2025, 24 newborns have reportedly died at the special care nursery of the Victoria Jubilee Hospital, the country's main maternity facility. The sharp rise in deaths has sparked alarm, especially among grieving families, healthcare workers, policy makers, and of course, the general public. Health authorities, including the Southeast Regional Health Authority, or SERHA for short, and Chief Medical Officer have denied any infection outbreak. They say the spike in neonatal deaths is linked to a seasonal surge in births, particularly premature and low birth weight babies who are more vulnerable. But the public disagrees. In response, SERHA has implemented emergency measures, more staff, improved spacing in neonatal units, heightened infection control, and increased monitoring of critical equipment and supplies. Good response, but what about being on offense instead of defense? We're talking about human lives here. No, not everyone is convinced. Opposition spokesman on health, Dr. Alfred Dawes, is demanding full transparency. He argues that blaming prematurity alone is insufficient, calling instead for a closer look at systematic failings like overcrowding, poor infrastructure, and staff burnout. And while the opposition's role for a while has been a little bit of a joke because all they do is oppose even when there are good policies, I myself have to agree with him in this case. Dr. Dawes has called on the government to release historical neonatal death data from 2020 to present, just to clarify how resources are allocated and explain why grieving families were not informed earlier on some of these deaths.
They convened a meeting to further investigate the matter.
The regional technical team, the regional technical director, and the other specialists, including the SMO at VGH, they are currently conducting deeper analysis to find out what the nature or the cause of those deaths. So I'm not able to speak on the matter in much detail in terms of what would have been the cause and the outcomes.
The Senate recently held a moment of silence in memory of the 24 infants who passed, a solemn recognition of the magnitude of the tragedy. Reports indicate nearly 200 babies have died at the facility since 2023. 200 babies. The Ministry of Health has launched a full epidemiological review to determine all contributing factors. Results of that investigation are expected to be made public in the coming weeks. So, we will definitely be following that story. Victoria Jubilee delivers thousands of babies every year, many under challenging conditions. This moment is not just a reckoning, really. It's a call for greater investment, transparency, and compassion in our public healthcare system. We will continue to follow the story as it develops. For now, our hearts go out to the families affected and the healthcare workers trying to save lives under these pressuring conditions. Until next time, I'm Whitney Mckoy. Be sure to subscribe to the African Diaspora News Channel for updates. Leave your thoughts in the comments. What do you believe is happening? Why are there so many deaths? Until next time, I'm Whitney Mckoy. Stay informed and stay connected.